What is Asperger syndrome? Part 4. What causes Asperger syndrome? Hans Asperger described common symptoms among his patients' family members, especially their fathers. Research supports this observation and suggests a genetic contribution to Asperger syndrome, although no specific gene has yet been identified. The suggested evidence of a genetic link is found in the tendency for Asperger syndrome to run in families, and an observed higher incidence of family members who have behavioural symptoms similar to Asperger's, but in a more limited form, for example, slight difficulties with social interaction, language or reading. Most research suggests that all autistic spectrum disorders have shared genetic mechanisms, but Asperger syndrome may have a stronger genetic component than autism. There may be a common group of genes where particular components render an individual vulnerable to developing Asperger's. If this is the case, the particular combination of genes would determine the severity and symptoms for each individual with Asperger syndrome. Intense world theory. Because autism covers a wide spectrum of disorders for which there are many views, hypotheses and theories, a unifying theory of autism, such as the intense world theory, may provide a major advancement in the field of autistic research. The intense world theory of autism was co-developed by neuroscientists Henry and Camilla Markram of the Brain Mind Institute in Switzerland. They present key studies that support this theory of autism, as well as show how the theory can better explain past findings, and how it could resolve apparently conflicting data and interpretations. The theory proposes that the autistic brain is characterized by hyperreactivity and hyperplasticity of neurons. This is thought to lead to greatly enhanced perception, attention and memory, which may lie at the heart of most autistic symptoms. The theory suggests that the fundamental problem in autistic spectrum disorders is not a social and empathetic deficiency, but rather a hypersensitivity to experience, which includes an overwhelming fear response. Studies have found that when people are overwhelmed by empathy, they tend to pull back. When someone else's pain affects a person deeply, it can be harder for them to reach out than turn away. For people with autistic spectrum disorders, these feelings of empathy might be so intense that they withdraw in a way that appears cold and uncaring. The intense world theory suggests that the autistic brain must be calmed down in order for the autistic individual to deal effectively with life and other people. In other words, autistics are too high functioning in some respects, and this is what causes their challenges. Virtually all people with ASDs report various types of oversensitivity and intense fear. The Markrams argue that social difficulties of those with autistic spectrum disorders stem from trying to cope in a world where the volume has been turned up on all feelings and senses. The intense world theory proposes that the cognitive consequences for anyone on the autistic spectrum are hyperperception, hyperattention, hypermemory and hyperemotionality. Hypercapabilities are one positive aspect of having such a brain, but the downside of it is sensory overload, avoidance of stimulus-loaded situations, and rapid lockdown into behavioural routines. The theory is centred on the neocortex and amygdala, but could potentially be applied to all brain regions. The severity of the molecular syndrome expressed in different brain regions would uniquely shape the repertoire of symptoms of an autistic individual. The proposed neuropathology is hyperfunctioning of local neuromicrocircuits, best characterized by hyperreactivity and hyperplasticity. Such hyperfunctional microcircuits are speculated to become autonomous and memory-trapped, leading to the core cognitive consequences of hyperperception, hyperattention, hypermemory and hyperemotionality. The progression of the disorder is proposed to be driven by overly strong reactions to experiences that force the brain to a hyper-preference and overly selective state, which may be particularly accelerated by emotionally charged experiences and trauma. This may lead to obsessively detailed processing of fragments of information and an involuntary systematic decoupling of the autistic individual from what becomes a painfully intense world. Treatment. There is no single treatment for Asperger syndrome. Intervention, such as behavioural therapy, aims to improve a patient's symptoms, focusing on specific areas such as poor communication skills, obsessive or repetitive routines, or physical clumsiness, but the effectiveness of intervention is supported by limited data. Most children with Asperger syndrome improve as they mature into adulthood, but social communication and emotional difficulties usually persist. Many researchers and people with Asperger's are calling for a shift in attitudes away from the belief that it is a disability that must be treated or cured, and toward the view that it is simply a difference. Furthermore, some researchers have argued that Asperger syndrome can be viewed as a different cognitive style, not a disorder, and that it should be removed from the standard diagnostic and statistical manual of mental disorders, much as homosexuality was removed in 1973. It has been suggested that the Asperger's combination of abilities have operated throughout recent human evolution, and have made remarkable contributions to human history. Proponents of this view reject the notion that there is an ideal brain configuration, or that any deviation from the norm is pathological, promoting tolerance for what they call neurodiversity. However, it might still be useful to consider Asperger syndrome as a disability, to ensure the provision of special support, and to recognise emotional difficulties. There is a contrast between the attitude of adults with self-identified Asperger syndrome, who typically do not want to be cured and are proud of their identity, and parents of children with Asperger syndrome, who typically seek assistance and a cure for their child.